Morning. Thanks for joining us here today. Thanks as well to Dr. Brent Roussin for joining us here today. And again, Brent, thanks so much to you and your team for all your hard work on behalf of Manitobans.
Thank you.
We really appreciate it. Got some good news today. We're taking another step forward to fully reopening. This is great for our economy. It's great for our communities as well. Manitoba's 4-3-2-1 Great Summer Reopening Plan set out a clear path for more openings, fewer restrictions, as more and more Manitobans get fully vaccinated. And I thank Manitobans for getting vaccinated. It's really helping, obviously, for us to get those shots and get our lives back. Thanks to your efforts, and I say also thanks to the efforts of our vaccination team who worked really, really hard. We continue to meet and exceed the vaccination goals that we set. I'm told that we're leading the country in second vaccinations, and that speaks well to Manitobans' desire to do their part to help us stay safe and protect our health system and all around us. We hit our second reopening milestone, as you remember, almost a month ahead of schedule, and now we're very close to hitting our third milestone early. As of today, 80% of Manitobans over the age of 12 have received their first dose, and we need 25,000 more Manitobans to roll up their sleeves in order to reach 75%, of Manitobans who would be fully vaccinated. Manitoba's administered 1.8 million doses of vaccine. Isn't that unbelievable? And that's a significant accomplishment, and Manitobans should be very proud of their collective efforts to protect one another and get back to doing some of those things we love and have really missed these past months that seem like years to many of us. COVID case numbers continue to drop. Vaccination rates keep increasing. Manitoba's in a good place right now, thanks to the hard work of our public health team and, of course, the collective efforts of all of you. Because of that remarkable progress, Dr. Roussin and I are pleased to announce that Manitoba is now in a position to reopen sooner. Today, we're introducing new public health orders, as well as a shift in some cases to public health recommendations and guidance. And I would emphasize continuing to follow those public health recommendations, even though they're not orders, is a very important way that we'll continue to keep that COVID curve bent down. This will allow us to further reopen our economy. It'll allow more freedoms as we approach that third milestone that we're very close to in our reopening path. Effective this Saturday, August the 7th, Manitobans will be able to enjoy more freedoms with expanded indoor and outdoor activities. Restrictions will be modified or eliminated altogether depending on the sector or activity and the associated level of risk. I want to assure Manitobans that, as always, these new public health orders and public health recommendations are based on science. They've always been designed throughout this miserable pandemic with the best advice of our public health leaders, and their recommendations have been followed. I'll now pass it over to Dr. Roussin to expand on the new public health orders. Thanks, Dr. Roussin. Over to you.
Thanks, Premier. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Manitoba has achieved one of the final immunization targets, again, well ahead of schedule. More than 80% of Manitobans aged 12 and up have now received at least one dose of the vaccine, and we're closing in on that 75% target of fully vaccinated Manitobans. 71.4% of Manitobans 12 and up have received 2 doses of that vaccine. So we're seeing lower numbers of cases per day, lower numbers of Manitobans being admitted to hospital and to the ICU, and of course these are all good trends as we move forward, and that continues to support our direction to moving from public health restrictions to public health recommendations. So as of Saturday, August 7th, new public health orders will come into effect. New orders will only restrict some of the most high-risk transmission environments, and so some sectors will be open without restrictions. And so these sectors that will be open without restriction are indoor and outdoor gatherings at private residences, gyms and fitness centers, libraries, personal services such as hair and nail salons, day camps, retail businesses, markets, garden centers, and malls. So other sectors will still have some restrictions, albeit loosened. So expanded capacity limits will remain in place for public gatherings, both indoors and outdoors, including larger capacity limits for worship and culture events, such as powwows. Restaurants and bars will no longer need to restrict the size or space between tables, and dining will not be restricted to household or vaccinated individuals. Patrons will still be expected to avoid congregating or socializing between tables. Museums, galleries, and movie theaters will be able to open to 50% capacity, but will no longer be restricted to vaccinated individuals only. Casinos, bingo halls, professional sporting events, horse and auto racing, and concert halls will continue to be limited to vaccinated individuals only. However, they can open at 100% capacity. Indoor and outdoor sports and recreation, including dance, theater, and music schools, will be permitted with no capacity limits on participants, but spectator capacity limits will still apply. Overnight camps will be permitted with limits on camper cohorts. Workplaces must continue to report COVID-19 cases to public health for follow-up. However, remote work is no longer required or recommended by public health. Instead, workplaces will be encouraged to transition to a general communicable disease prevention plan to reduce the risk of workplace transmission of COVID and other respiratory viruses that are very likely to resurge this fall. Public health will no longer require mask use in indoor public places under the public health orders. However, we know that COVID-19 will be with us. COVID-19 will be here in a post-pandemic Manitoba, as well as the other respiratory viruses, such as influenza and RSV. So we are still highly recommending that Manitobans wear masks in indoor public places for everyone 12 years in age and older who is not fully vaccinated. Wearing masks in indoor public spaces for children under 12, as well as maintaining that physical distancing. So again, we're moving from public health restrictions to recommendations, but we know that COVID is still with us. And we still know those places, crowded spaces, prolonged contact increases the risk of transmission, not only COVID, but the other respiratory viruses that are likely to return. So we're slowly approaching that post-pandemic Manitoba that we've been discussing. And so this is why we've been able to lift some of these restrictions moving forward at this point. The continued shutting down of our economy and our society is not realistic in the long term. We have to learn how to live with COVID as well as the other endemic respiratory viruses as we move forward. We're very likely to see increasing numbers in COVID, especially amongst the unvaccinated Manitobans. We're very likely to see rising cases of influenza and other respiratory viruses as well this fall. So we need to, again, take those public health recommendations to heart and ensure we're all reducing the risk to ourselves and the people around us and to other Manitobans. And so rather looking at daily case numbers, we need to focus more on the severe outcomes such as hospitalizations and death. And this is going to be especially true as we're going to see those predominate in unvaccinated Manitobans. So public health recommendations and guidance rather than restrictions will continue to play an increasing role as we move forward. This means that the fundamentals are still here with us. We're still recommending Manitobans follow the fundamentals, but they'll be less and less included in public health orders and more in the guidance that we all need to follow. As we move forward, this is a significant reopening for Manitoba. It's the largest loosening of restrictions since the beginning of this pandemic. So I still want to remind Manitobans to be patient with others, be kind with others. There'll be people who are more open to the loosening of restrictions than others. Some people may still choose to not take part in crowded events. Some businesses may still require the use of masks. So we should be patient with each other as we move forward, follow those recommendations. And again, businesses, individuals have never needed public health restrictions to protect themselves from COVID. So we still want people to step up, protect themselves, protect their employees, protect their patrons, protect people around them. And so this will take time in this transition to a post-pandemic Manitoba. So be patient with each other, be kind, and again, thanks to Manitobans for putting us in this position to reopen again early. So thanks, and I'm going to pass it back to the Premier.
Thanks very much, Dr. Roussin. I also want to say thanks to all Manitobans again for their efforts to not only roll up your sleeve, but your commitment to follow those public health orders that are in place to help bend that COVID curve down, not just now, but for good. Today's good news announcements is one that we want to sustain. We want to keep it going. And it's going to be an exciting week for Gold Eyes fans. It's going to be an exciting week for Bomber fans. Let's keep it that way and do our very best to follow these public health recommendations now, in some cases, or orders, as some are still to be maintained. We aren't out of the woods yet. We've seen it around the world. A lot of other nations, a lot of other states are having big pushes up in terms of their numbers. We want to avoid that here in Manitoba. So we have moved somewhat cautiously compared to many other jurisdictions. We've got some public health measures that are still required to keep Manitoba's COVID curve down. They're necessary, as we've learned, to protect our hospitals, protect our communities. So as Manitobans, we're going to continue to have, as I know you've heard me say before many times, two really important public health responsibilities. One, get vaccinated, not once but twice. And two, follow those public health orders and recommendations. They're designed to help you protect yourself and others and keep COVID away. The RBC Convention Centre super site's offering walk-in vaccines from 9 a.m. to 8 p.m. every day now. Encourage you, if you haven't yet, to go and get vaccinated there. There are many other sites as well. Manitobans who received their first dose by the end of the day yesterday are entered into our first ever Vax to Win lottery for cash prizes and for scholarships. And we will be announcing those winners August 16th at the Leela Super Site. Adults can win up to $100,000 cash. Youth are eligible to win a $75,000 scholarship, and wouldn't that be nice? If you get your second dose honored before September 6th, again, September 6th, you'll be in the second draw. We're so close to achieving all of our vaccination milestones, but to reach that Labor Day immunization milestone we set out in our 4-3-2-1 plan, we need 25,000 second dose vaccinations, and I'm confident that we can reach that goal any day now. We need everybody on Team Manitoba for the final stretch. We can do this if we work together, and Manitobans are famous for doing that. So please, get vaccinated, keep following those fundamentals, and by doing so, you can confidently enjoy these new freedoms, knowing they're here to stay, not just this summer, but as we move into fall and winter as well. Thank you. Look forward to your questions.
Thank you, Mr. Premier. Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from the Brandon Sun, Kimberly.
Good morning, Mr. Premier. Thank you for having us today. My first question is for you, sir. Your government was clearly upset over Manitoba's Chief Justice Glenn Joel being followed by a private investigator by the organization representing several churches recently, and yet your government hired a private investigator to investigate NT team leader Wab Kinew. That does sound hypocritical, so I'm just wondering if you have a comment. What would you like to say?
Well, it's our obligation to do research, and when we receive allegations that someone has covered up a criminal record, it's important to do the research and get the facts. This record was covered up, so we had a criminal record check done, and I think that's an appropriate thing to do. I think research matters.
Thank you. My second question is, are there any chances that Manitoba will implement mandatory vaccines, especially to post-secondary staff and students this fall?
So at this point, we're still relying on Manitobans to get vaccinated, to get 2 doses, and you can see we've been reaching our targets early. And so the more and more vaccine that's into Manitobans' arms, the better for our chances of avoiding a fourth wave or avoiding the a severe fourth wave. So we want to still encourage Manitobans to get vaccinated. We don't have plans in those areas to mandate vaccine at this point. But certainly, like I said, as we move to public health recommendations from orders, we may see certain businesses or organizations doing things that they feel protects their patrons and employees the most.
From CJOB, Alicia.
Good morning. Dr. Roussin, can you explain why we are loosening restrictions when Canada's Chief Public Health Officer says we are at the beginning of a Delta-led fourth wave? All around the province, Delta cases are increasing. So can you just explain why we're moving ahead with things like no masks and looser restrictions?
Yeah, and so again, each province has to follow the epidemiology in their province. So certainly we might see the beginnings of a fourth wave in certain areas, potentially around the world. But in Manitoba, although we're seeing an increasing proportion of cases of Delta, we're seeing that in the face of declining case numbers and declining test positivity. So Manitobans have stepped up, got vaccinated. We still need more. The 80-75 isn't the end target. We need many more Manitobans to continue to get vaccinated, to delay and to lessen the impacts of a fourth wave that's coming. But right now, Manitoba, we're in the position to further loosen restrictions. And again, moving forward, we'll have to watch our numbers very carefully.
Thank you. Also, several parents have reached out to me to ask about what are we going to do about kids who are too young to be vaccinated yet? School is a month away, and many parents I know are very worried about sending their kids to school without being vaccinated.
So we'll have more to speak about later this week on the return to school plan. But I would note that the younger children are certainly much less at risk of severe outcomes. They're much less able to spread this virus. So we'll have more detailed plans, but we feel moving forward with our numbers, with the vaccine rates throughout Manitobans, that we'll be able to return to school as normal as possible for this fall.
Thank you.
From the Winnipeg Sun, Josh.
Good morning, Premier and Dr. Roussin. Dr. Roussin, my first question is just looking at the numbers, we're very close to that second level of vaccinations, or second goal for for second doses. Are you assuming or predicting we'll hit that level of 75% by Saturday, or is just we're kind of on base to hit it sooner rather than later, so we're moving forward now? I'm just trying to clarify where you predict we'll be on Saturday for second doses when these health orders come in.
Yeah, if we follow our trends, it's very likely we could hit or be very close to that number by this Saturday. So we felt that it was an appropriate time with these orders expiring on Saturday that we could move to the next level, knowing that if we're not at it, we'll be very, very close.
And Premier, for my second question, there's been a lot of call for you to address the comments that you made about 3.5 weeks ago, which caused Eileen Clark to resign, and more recently, a few minutes after the new Indigenous Affairs Minister made his comments following the swearing in. Why do you kind of remain silent to this point on those comments? and especially considering today, I believe, is the 150th anniversary of the signing of Treaty 1. Is there anything that you would like to say or to address those comments and the controversy since then?
Yeah, I feel awful about the reaction and the misunderstanding I created with my comments, Josh. I've worked for a long, long time on reconciliation efforts. Before we set up the Truth and Reconciliation Commission, I was proud to be part of the government that did that. So I'm going to issue a statement later today, ask for forgiveness and understanding, and ask that we unite. That was what I was trying to do with my comments, as you remember. I was trying to unite people to build, as our Indigenous people have done for millennia, as our Métis population's done, as our more recent immigrants have done. Try to build together. I think that's what we have the opportunity to do now as a result of the horrible shock that many Canadians are experiencing with the discovery of unmarked graves. And so I'm hopeful we can move forward, and I do apologize for the misunderstanding I caused.
Thank you.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. You said that you're eliminating the mask mandate right now based on the epidemiology in this province. But Delta hasn't arrived in earnest yet, and you have presented no modeling, no projections on how it will behave, especially in areas where we have low vaccination rates and among people under 12 who can't get vaccinated. So what medical opinion allows this province to eliminate a mask mandate now before we know precisely or even vaguely how this is going to work in a couple of weeks?
So we're looking at our epidemiology right now and the trends right now. So we see case numbers declining, we see test positivity, hospital admissions all declining, while immunizations are increasing. So it puts us in a position right now to loosen those restrictions. We know that modeling provides us with multiple scenarios. So, and no model that we have right now can predict for sure what's going to happen in the future. So we are still working on that modeling, and we'll be presenting that as soon as we have one that's ready to present. But we're in a position right now to loosen. We know that just like in other jurisdictions, if necessary, especially in certain geographic regions, if we're seeing outbreaks, we may have to consider public health measures, but we'll have to keep close eyes on those. So right now we're in a position to further loosen things. So that's why we're taking this step.
Okay, Mr. Premier, what do you say to the notion that the longer you stay on as Premier harms your party's chances of winning re-election?
I'd say we just came through a hell of a time here as people, and today we get to loosen restrictions more than we have in a year and a half, and I'm pretty proud of that. Pretty proud of the work our team has done in government, and I'll continue to be very mindful of my responsibilities to my province and party, as well as to my family.
From the Canadian Press, Steve.
Good morning. Dr. Roussin, the vaccines, all the data is showing that the vaccines are doing a tremendous job in terms of preventing serious outcomes, trips to the intensive care unit, et cetera. But the data is also showing that the Delta variant is proving to be very transmissible, even among people who are vaccinated. So given the fact that the data we have so far points to increasing transmission, even among the vaccinated, why are we loosening orders now?
The most important aspect of that is that severe outcomes are much reduced with fully vaccinated individuals, and that's the public health response, the public health restrictions had always been designed at limiting severe outcomes, so hospitalizations, ICU admissions, and of course deaths. We see that just like any vaccine, no vaccine or any medical intervention is 100%, and so we can still see transmission occur with fully vaccinated, but it's much less frequent, and it's much less severe, especially in people who who are exposed and are fully vaccinated. So vaccines are still providing that tremendous benefit. We still need more Manitobans, many more Manitobans, to get vaccinated as we move forward to that fourth wave. But remember, these restrictions have significant effects as well. So when we're in a position where we are now with declining case numbers, with declining test positivity, declining hospital admissions, where we have 80% of Manitobans, eligible Manitobans, now receiving at least one dose, we're in a position to loosen the restrictions that have had such a profound effect. So of course we need to continue to watch things as we move forward. We have to protect the health of Manitobans, but these restrictions also have significant impacts on Manitobans' lives and health.
And Premier, your government has been polling very low lately. There's controversy that doesn't seem to be going away over your remarks on Canadian history. Some caucus members have been distancing themselves from your remarks, and you've previously left the door open to leaving office sometime before the next election. Are you considering leaving office in the coming months?
2 points, Steve. One, you'll be among the first to know if that's the decision. And secondly, as far as the previous question, I think it's important to understand that despite having comparable or lower numbers, case numbers than other jurisdictions, we're moving slower. And some are, saddened by that and critical of it, but we're moving slower in a number of respects. For example, our movies are only to 50% capacity. Next door in Saskatchewan, they're 100%. We're only allowing double vaxxed in at that Bomber game. Others are talking about anybody coming in. We've delayed our reopening, loosening of restrictions by a number of weeks compared to our neighbors in most respects, and I think that's important to understand. We're cautious and aware, and I would also say that one of Canada's most respected think tanks, the Macdonald-Laurier Institute, released an analysis of how COVID's been handled over the last year and a half, just last week. And they ranked Manitoba's handling of this pandemic ahead of every other province outside of the Maritimes. I think that's a tribute not only to our government, I think it's a tribute to Brent Roussin and his team. I think it's a tribute to Lynette Siragusa. I think it's a tribute to our vaccine team. It's a tremendous compliment. But it doesn't stop now. COVID's not stopping, and we have to learn to live with it, and I think that's in part what's at the cornerstone of these changes today. It's to give Manitobans an opportunity to remember that you stick to those fundamentals, you limit your risks, you avoid close contact settings, crowded places, closed spaces, you do that, and you wear a mask when you're inside, even though it's not a rule now, it's a recommendation, and it's a strong one to make sure you do that. These are the kinds of things that will help us to make sure we keep that COVID curve bent down, and I think that's the goal everybody really shares now.
From CTV Winnipeg, Michael.
Hi, Dr. Roussin and Premier Pallister. On the mask mandate, it's been lifted, but you're still encouraging those who aren't vaccinated to wear a mask indoors. I guess my main question is, do you really expect folks who are not getting the best protection of against the virus to actually wear a mask? And by lifting the mandate, are we not endangering these individuals, especially in the face of the more infectious Delta variant?
So again, we're moving towards a post-pandemic Manitoba that has public health recommendations rather than orders, and this is a continuum of that approach. And so individuals are going to have to do some level of a risk assessment for themselves as well on whether they want to wear masks indoors. Certainly it's a strong recommendation, especially those at higher risk, especially those who are unvaccinated. And then again for vaccine. We strongly recommend all eligible Manitobans to get vaccinated as soon as possible, twice. It's the best way to protect themselves and the people around them, as well as decrease our risk for a substantial fourth wave here in Manitoba. So we are making that shift, and we're really going to be relying on Manitobans to continue to step up.
And And as a follow-up, Premier Pallister, you mentioned how other jurisdictions are reopening at a quicker pace. I'm specifically going to mention Alberta. They've basically lifted all restrictions, and yet we're there seeing higher case counts and a spreading virus. I'm wondering, is the province considering travel restrictions on Alberta specifically, or on other provinces specifically, as they start their reopening and potentially mishandle their reopening plans?
Not at this point in time, Michael, and we hope we don't need them, and we're all of us, I hope, cheering for Albertans too. But it is duly noted that not every jurisdiction has got the same epidemiology. Not every jurisdiction is in the same place. We're in a good place right now, and yahoo to that. I think we should all be excited about today. But what'll keep us excited is keeping COVID at bay. And that's the challenge we have going forward. We have to learn how to live with COVID. It's not going to go away. But neither will the resolve, I believe, of Manitobans to stand up against it and do the right things to protect themselves and others.
From City News, Mark.
Hi there. I'm wondering if there's any extra resources or plans being put in place at hospital as we loosen restrictions. You say we're going to see numbers go up and infections go up, specifically among the unvaccinated. How are we going to make sure the healthcare system isn't overwhelmed as we open up more in the province?
Yeah, well, we're still in our incident command format, so we still have the healthcare system responding and planning to such events. We know that we're going to see increasing COVID-19 cases, especially amongst the unvaccinated. We know we're going to see a resurgence of other respiratory viruses that we normally see, influenza, RSV, and so the healthcare system is planning for such scenarios.
Thank you. I'm wondering, you suggested to Manitobans to be patient, and I can imagine, too, as we move from restrictions to recommendations, that there will be some businesses and services who do mandate masks or other health safety protocol. Others will not like that. Do you think there's going to be more anger and aggression as a result of what's being done here today?
Well, I think we need to avoid that. I think we need to know that COVID-19 is not done with us. COVID-19 is still going to be here, especially amongst the unvaccinated population. In addition to that, as we have more interaction between Manitobans, we're going to see a resurgence of those other respiratory viruses. So again, we're risking straining that healthcare system, so that healthcare system can't deliver for all Manitobans. If they're focused only on respiratory illnesses. So we still need to be very cognizant of this. We still need to protect one another. And I think that, again, we've never needed public health restrictions for places of business to protect their employers and their patrons. So I think that they're going to continue to do so. And some of those measures might look different. There might be some variability between businesses, but I think we all need to respect that the efforts are there to protect not only the patrons and the employees, but also all Manitobans.
From CHVN, Taylor.
Hey, good morning. Mr. Premier, why have you been silent since Minister Lachimodier's comments?
Well, Mr. Lachimodier offered an immediate apology for his own comments, and I, in the same press conference, stood by my words. Subsequent to that, I've seen more and more misinterpretations of what I said, misrepresentations of what I said. I wasn't talking about settlers or post-Canadian colonists. I was talking about all of us. I was talking about the work of people like Chief Peguis. I was talking about the Métis settlers who wanted to develop farms and were pushed back. We've got builders throughout our history, throughout our heritage, and it's something we share. And it's something the TRC report said. It quoted elders when it said that we should look at our shared goals. And I was trying to bring people together. I reflected on that. I saw the reactions, and I understood that I was misunderstood. And I apologize for that. I should have been clearer in my comments, but my heart was in the right place. And so that's why I'm offering the statement of apology today and asking for people's understanding. Let's move forward and build. That's something I've been after for years and years, decades.
Thanks. And Dr. Roussin, with mask use being up to the business to decide if they want to require it or not, is the same sort of thing going to be allowed for businesses wanting to keep the restrictions regarding fully vaccinated people?
So again, this is, we're moving towards our, public health recommendations. And so businesses are going to have to review the appropriateness of those measures, the acceptability of those measures. So right now we have some recommendations, we still have some orders, but individual businesses are going to have to decide on the appropriateness of additional measures.
From the Winnipeg Free Press, Carol.
Good morning. Premier, can you talk a bit about why you appointed Alan Logimodier, Indigenous Reconciliation Minister, about what his mandate was, and why didn't you publicly come to his defense when he admitted ignorance about residential schools?
Alan's a fine man. He's an accomplished person who's risen from not much to achieve great things in his life, and he is a caring person who understands the challenges in front of him and has faced up to them. He apologized immediately for his comments, misrepresentation around the nature of residential schools. And I stand by him, and I think he will do a wonderful job in that portfolio. He's reached out to everyone involved. He's offered sincere efforts to work together to redeem himself in the minds of some and to prove himself in the minds of others. And I know he'll achieve good things in that portfolio.
But Premier, why didn't you come out publicly and defend him after we haven't heard from you in a couple of weeks? Why didn't you respond right away, stand beside him and say that, he's a fine man and, this is why he's going to be good as Indigenous Reconciliation Minister?
Gee, Carol, all I can say is that I did my research, and I would encourage the Free Press to continue to do theirs on Wapkaniw and make it public when they find things out rather than covering them up. I think that's important to do. And so I have to say to you, I stand by the quality person that Al Logimodier is. He's never engaged in any criminal activities. He's worked hard all his life, and his record is a matter of public record. And he stood and he apologized for his words, as I am doing today for mine, and the misunderstanding I created. I think that's the honorable and right thing to do. We're both of us very, very focused, as is our entire team, on making sure that we create a Canada where our Indigenous friends and neighbours, our relatives, are not only respected but given equal opportunity to succeed and find their way in life. And that's what we're going to stay focused on.
And how do you justify using taxpayer resources for the Executive Council to oversee the plan to dig up dirt on the leader of the official opposition?
Undisclosed criminal record is hardly the same as digging up dirt. When we had information brought to us about a criminal record that the NDP had covered up and that their leadership candidate, Wapkaniw, had covered up, we didn't take it at face value. We researched it first to make sure that it was factual. And it turned out it was. So Mr. Kaniw covered up his record. It wasn't in his book. It wasn't in any of his previous statements. He ran for public office without disclosing a rather lengthy, over a number of years, interaction with the justice system. It's the obligation of all of us to do our research in political, not just political parties, but I would hope in the media as well, and that's what we did. And I would encourage people who want to enter public life to remember, just as I am reminded frequently, that your life is on display. And I encourage Mr. Kaniw to come clean about any other interactions he may have had with the Justice Department or various criminal activities, because the sooner he wrestles those demons, the sooner forgiveness will come, and that's what I hope for him.
Our final reporter this morning from Global News, Brittany.
Good morning, Dr. Roussin. If you don't have the modeling data completed yet, and we've seen what's happened in other provinces when they loosened all the restrictions, gotten rid of them, got rid of that mask mandate, why aren't we looking at those provinces and learning from them and seeing these case numbers going up and still loosening our restrictions here? And specifically the one I think a lot of people are looking at is getting rid of that mask mandate.
We do look at other jurisdictions quite frequently. We meet frequently with my counterparts in all the provinces. So we are looking at those areas. If we look at our case numbers right now in Manitoba, where they are trending significantly down. All our numbers are good where we need to be. This is a time to loosen restrictions. If we leave restrictions on, thinking that at some point they might increase, we will be in a constant lockdown here. And we know that that has significant health impacts as well. So our epidemiology right now supports the further loosening of restrictions. We're of course going to watch things closely. We know that there'll be a resurgence of other respiratory viruses, but we have to accept that these public health restrictions also have health consequences. So when we have an opportunity to loosen them, we should take advantage of that.
Thank you. And I'm just wondering too, with music, we've had a ban on choirs at some point. Church choirs, you still needed to wear a mask in certain areas. Is there going to be any restrictions when it comes to, church choirs, bands, or for music in schools?
So we don't have any specific restrictions in that regard. We've limited capacity, say at churches. The reason to limit capacity means we want that distance between people. So we're still going to have that recommendation. Again, we're lifting the mandate of masks, but in high-risk situations such as singing, that's something that should be considered to ensure there's significant spacing between people, to have masks on if that can't be done. So again, moving to those recommendations rather than orders.
Just to wind it up, thanks to everybody. Manitoba's been invited the opportunity to host the Council of the Federation meetings in October, and so that preparatory work is pretty intense and underway. And also discussions with all the premiers, provincial and territorial, on how we can proceed to push for a better deal for health care, a 35-65% ratio, so the feds actually are offering more support so we can deal with the massive backlog of surgeries and tests, in addition to the growing wait times for other procedures that's resulted from this COVID pandemic, and many of those problems existed prior to that. So this work is going to continue. It's very intense, but it's going to continue. We've been asking the Prime Minister for meetings, but he is, as yet, not available. There's a lot of anticipation of an upcoming federal election, and so I know the Prime Minister is busy and his schedule is full. But nonetheless, healthcare remains one of our top priorities, and so we'll continue to focus on getting a better deal for the country and for the people of Canada on healthcare from the federal government. Thanks, everybody.